The morning feels the same. You walk into the kitchen, reach for the familiar cup, intending to do something very small, and suddenly forget what it was you were about to do. It must be age. Your pants feel a little looser. Maybe I have just been eating less lately. Fatigue lingers throughout the day. Last night I stayed up too late. These little reassurances sound so reasonable, just enough to keep us moving forward without stopping to ask, what is the body trying to whisper? The truth can be startling. 40% of serious health problems in older adults begin with the quietest of signs, ignored for months, sometimes even years. They do not scream, they do not send us rushing to the hospital, they are as silent as the ticking of a clock, and we label them with a familiar phrase, just part of getting old. But what if those small signs were actually your greatest advantage in protecting your health and independence? What if noticing them early was the very key that could unlock more years of active, lighter, and more confident living? Today, we will walk together through 7 symptoms that may seem quiet, but could be pointing towards something serious yet still possible to act upon. Not to frighten you, but to help you know exactly when those everyday changes deserve your attention. Let me be by your side, like a trusted friend, helping you ask the right question at the right moment. Is this truly just normal? Or is it a reminder to pay closer attention? And in just a few minutes, you will know when to simply observe, when to call your doctor, and most importantly when to trust your own intuition. 1. Unexplained weight loss. There is no alarm bell. Just a belt that tightens one notch less, a shirt that once hugged your shoulders now hanging a little loose, a lunch plate left unfinished because food tastes duller than usual. You are not dieting, you are not exercising harder, yet the number on the scale keeps slipping down, like the quiet tick of a clock hand inching forward. In midlife and later years, that is not simply a few pounds of water loss. A daily fluctuation of 2 to 3 pounds is normal, but if over 6 to 12 months you lose about 5% of your body weight without intending to, your body is sending an important signal, and this signal is not rare. It can be found in around 20% of older adults in the community, and in nursing homes, that number may rise to 60%. The hopeful part is that nearly 75% of cases reveal a cause if medical attention is sought early. Why does weight quietly fall away? Picture your body as a house with a furnace, pipes, and a thermostat. When the furnace burns fuel too quickly, you spend more than you take in. Certain illnesses increase metabolism, from hyperthyroidism to cancer, forcing the body to burn both fat and muscle just to keep running. When the pipes of absorption are faulty, you may eat enough, but the cells remain hungry. Damage to the intestinal lining from digestive disease or poor pancreatic enzyme function lets nutrients slip by unabsorbed. When the thermostat of appetite malfunctions through nausea, changes in taste, reduced smell, or difficulty swallowing meals become burdensome, sometimes due to medication, sometimes due to depression or neurological decline. And when hormones falter, from blood sugar imbalances to thyroid dysfunction, the body is forced to draw capital from its own reserves. Among all causes, cancer is the most common culprit, accounting for more than 35%. Weight loss can appear early in about 40% of new diagnoses, and adults with unexplained weight loss are 12 times more likely to have an undiagnosed cancer. In later stages, the wasting syndrome appears in many patients, as inflammatory alarm chemicals both accelerate energy burning and blunt appetite. Digestive disorders explain 10 to 20% of cases, from intestinal disease to pancreatic insufficiency. Mental health conditions account for 10 to 23%, when depression or memory decline make meals forgotten. Hyperthyroidism affects 5 to 10% of older adults, especially women. The heat intolerance, hand tremors, and racing heartbeat may show up, but sometimes the only visible clue is clothing growing looser. What signs call for action? If you weigh 150 pounds and lose about 7.5 pounds over 6 to 12 months without trying, especially after age 65, that is the threshold to seek medical care. If weight loss comes with fatigue, fever, night sweats, localized pain, or changes in bowel habits, the urgency grows. The first step is your primary care doctor. They may order blood tests such as a complete blood count, thyroid hormones, or mental health screening. Depending on findings, Imaging like CT or MRI may be considered. Timely intervention makes a real difference. Studies show that early treatment improves outcomes in up to 80% of cases where a cause is found. Some causes can be turned around with a simple dietary change, like diagnosing celiac disease and adopting a gluten-free diet. Others, if detected early, carry a much higher chance of survival. The hardest part is not always medical, but lies in our fear and our silence. Many older adults hesitate to speak about weight loss because they dread bad news, because they think this is just normal aging, or simply out of a lifetime habit of endurance. In reality, 30 to 50% of people with significant weight loss never mention it to their doctor. If you recognize yourself in these words, this is not a judgment. This is a hand reaching out. Speak to your doctor, share with your loved ones, let your body be heard at the right time. Taking initiative today may preserve strength, independence, and the quality years of life you truly deserve. 2. Persistent fatigue. The morning begins, as if your body has just run up a long, steep hill. You sit up, drink some water, try to catch the rhythm of a new day, only to realize that this exhaustion has been clinging to you for weeks, even months. Sleeping longer does not make it better. Resting more does not make it better. This is not the kind of tiredness that comes after a day of heavy gardening or a single night of poor sleep. This is fatigue that holds on to you, quietly stealing your focus, your enthusiasm, even the small tasks that once felt effortless. In older adults, this is not rare. In some places, nearly half of seniors struggle with it. And when it is new, getting worse, or coming with weight loss, pain, or fever, it is no longer just a part of aging. The difference is clear. Normal tiredness is the threshold where the body asks us to stop after a day of work or an intense workout. With 7 to 9 hours of sleep and a balanced routine, the next day we recover. Fatigue caused by illness is different. It is like a battery that refuses to charge, no matter how long it is plugged in. It slows down everything. Getting out of bed, climbing a few steps, focusing on the morning paper can feel overwhelming. Behind it may lie processes more complex than temporary energy loss. Inflammation consuming resources in silence, endocrine disorders pushing metabolism off track, or the cell's power plants failing to generate enough energy to sustain the body. The roots of this exhaustion are many, and each one calls for a different approach. Sometimes it is anemia when red blood cells cannot carry enough oxygen, leaving you dizzy, short of breath, and with a racing heart even during light activity. Replenishing iron or vitamin B12, or treating hidden bleeding in the gut, can change everything. Sometimes it is heart disease, reducing blood flow to the muscles. Fatigue appears early with effort, often joined by chest heaviness, swollen legs, and breathlessness. The thyroid has its voice as well. Hypothyroidism slows you down, leaves you cold, and increases weight. Hyperthyroidism burns you like a furnace, draining you even when you eat well. Sleep itself may be broken apart by sleep apnea, very common in older adults, leaving you groggy, headachy, and irritable during the day. A simple CPAP machine can restore real rest. Sometimes the culprit is chronic infection or autoimmune disease, where the immune system's alarms never switch off. Sometimes it is cancer, where fatigue can arrive early, overshadowing all other symptoms. Mood also leaves fingerprints on the body. Depression drains interest, fragments sleep, and erodes energy. Other pieces of the puzzle include diabetes, kidney or liver disease, fibromyalgia, chronic fatigue after viral infections, vitamin and mineral deficiencies. Even familiar medications, like antihistamines or beta blockers, can quietly pull you down. Yet persistent fatigue is easy to dismiss. Many see it as just a sign of aging. Many are reluctant to complain, afraid of bothering family, or fearful of hearing bad news. In the clinic, fatigue feels subjective, overlapping with many existing conditions, which delays proper evaluation. That is concerning, because prolonged exhaustion predicts outcomes we hope to avoid: falls, hospitalizations, reduced lifespan. In this case, silence is a form of risk. So when is it time to act? When this fatigue lingers beyond a few weeks, interferes with your daily living, or comes with weight loss, pain, fever, or breathlessness, it is time to see a doctor. The first steps are often simple. Blood tests to check your counts and thyroid, sleep studies if apnea is suspected, imaging if needed to find the cause. The hopeful news is that early intervention often changes the story for anemia, heart disease, thyroid imbalance, proper sleep support, or cognitive behavioral therapy when depression is present. You are not weak for speaking about your fatigue. You are choosing to be proactive. Let a single appointment, a single honest conversation, become the small but decisive step to reclaim strength, independence, and the quality of life you deserve. 3. Cognitive decline and confusion. There are days when you find yourself standing in the middle of your familiar kitchen, suddenly unable to remember why you walked in. You pause for a moment, and the memory drifts back like a shadow returning. If it happens once in a while, and you recall it a few minutes later, it may be ordinary forgetfulness of age, like misplacing your keys, but retracing your steps to find them. But if the way home suddenly feels unfamiliar, if you repeat the same question again and again even after receiving the answer, if a once familiar recipe becomes difficult because you can no longer organize the steps, that is a different story. Cognitive decline and confusion are not just old age. In adults over 65, mild impairment is fairly common, and when it progresses to dementia, it intrudes on memory, language, reasoning, organization, undermining the independence that was once your pride. This picture is wider than a simple lapse. In some forms, the brain is damaged by abnormal protein deposits, as in Alzheimer's disease. In others, the brain's tiny blood vessels are injured, leaving gaps in processing, forming vascular dementia. Worldwide, tens of millions live with this reality, and each year brings millions more. What makes it easy to miss is the fragile line between normal and alarming. Forgetting a name and recalling it later is not concerning. Getting lost in a familiar neighborhood, becoming confused about the date, or making poor financial decisions are red flags. Do not overlook changes in personality either. Someone once cheerful becoming irritable, withdrawing from conversation, or appearing lost in familiar routines. Often the earliest signs show up in the backstage tasks of life. Bills that are paid late, pill bottles taken in the wrong dose, a once tidy home growing unexpectedly disordered, a phone ringing unanswered because the words no longer come easily. Family and friends are often the first to notice the rhythm slipping. Even when you simply feel, my memory is not what it used to be, while tests still appear normal, that subjective experience is worth listening to, because it often travels with changes in sleep or mood. What matters is not blaming age, but noticing the shift over time, from occasional to frequent, from self-managed to dependent, from safe to at risk of falling or wandering. One condition deserves its own mention: delirium. It comes on suddenly, over hours to days, with confusion that rises and falls throughout the day, and it can often be reversed if the cause is found. Among hospitalized older adults, delirium is not rare and carries risks like longer hospital stays. Its foundation may be a urinary tract infection, especially in older women, where fever, burning pain, and confusion contribute to many cases. It may be dehydration or electrolyte imbalances, such as low sodium or high calcium, low blood sugar in diabetes, a clot interrupting blood flow in a stroke or transient ischemic attack, or side effects from sedatives or anticholinergic drugs in an already long list of prescriptions. The hopeful part is that when the root is identified, this fog can lift as quickly as it arrived. So what is the next step? Do not wait until confusion takes away your power of choice. Make an appointment with your doctor for a thorough evaluation, cognitive testing, brain imaging if needed, and simple blood tests that can sometimes reveal correctable causes, such as vitamin B12 deficiency or thyroid disease. If you are the loved one quietly worrying, write down the specific changes with dates. Those details become the map guiding the doctor's direction. This is not a judgment. This is a signpost. Recognize early, act early to preserve your memory, your independence, and your dignity. 4. Mood changes and depression. There are days when you notice your smile thinning into something as fragile as a thread. Not exactly sadness, but a quicker temper than before. Familiar gatherings suddenly feel heavy. A book you once loved opens and closes after only a few pages. Many call it just aging, but in midlife and later years, these quiet changes in mood may be the knock of depression. Across the world, mental health disorders in adults over 60 are far from rare, and depression leads the way, dragging down quality of life, independence, and even survival. At its worst, it is not as loud as we imagine. It often walks alongside chronic illness, cognitive decline, or loneliness, making it even harder to recognize. The unfortunate truth is that only 1 in 10 older adults receives proper treatment, even though this is the very stage when care can make a profound difference. Why is depression in later life so easily mistaken? Because it rarely shows itself as clear sadness. Instead, it wears the mask of irritability, restlessness, indifference, withdrawal from friends, or unexplained headaches, back pain, or digestive troubles. Add to this the reserved norms of a generation trained to endure, and these symptoms are too often dismissed as just age. In the clinic, mood disorders overlap with chronic pain, dementia, or side effects of medication, leading to misdiagnoses at the very first step. When fatigue and disrupted sleep join in, the circle tightens further, circadian rhythms shift, days grow heavier, and nights are no longer a refuge. Warning signs are not only in feelings. Sometimes they whisper in words like, "I am no longer useful." Sometimes they hide in clothes worn again and again because self-care feels pointless, in unfinished meals, or in sleepless nights strung together. When an older loved one speaks more often of death, of wanting it all to end, it is time for immediate evaluation, especially in older men, where the risk of suicide is strikingly higher. Depression does not only touch the mind. It stirs inflammation, weakens immunity, and worsens chronic disease. Cardiovascular risk doubles, mortality after stroke triples, and the management of diabetes, arthritis, or dementia falters. As willpower fades, medications are forgotten, activity slows, health costs rise, while health itself declines. And yet there is always a door open. Remember Robert, 75 years old, newly widowed. Irritable, no longer going to his weekly book club because he was too tired. His family thought it was just aging until he muttered, "I am useless." An appointment with a psychiatrist, a few screening questions on a geriatric depression scale, and a straightforward plan combining a selective serotonin reuptake inhibitor with cognitive behavioral therapy. 3 months later, Robert was back with his friends, sleeping better, with conversations full of life again. His story is not an exception. It is a reminder that late-life depression can be treated. If you find yourself in these words, this is not a judgment. This is a gentle yet urgent invitation. Speak to your doctor, share with your family, write down the small shifts in your mood and sleep so that the larger picture is not missed. Early screening opens the way to effective steps, from restoring daily rhythms, moving regularly to ease inflammation and lift serotonin, to therapies proven to help. One appointment, one conversation, one short walk, small steps, yet powerful enough to turn the course so that you can keep your health, your independence, and your dignity. 5. Sleep disturbances and social withdrawal. There are nights that shatter into countless pieces. You toss and turn, drifting off only to be jolted awake by an indescribable restlessness in your legs, or by a breath that catches and suddenly scrambles for rhythm. Just as sleep returns, your bladder calls you up again. By morning, even the cup of coffee cannot awaken anything. The lunch with friends is postponed, and then postponed again. Slowly, you stay home more. You speak less. It feels like fatigue, but beneath it, a hidden spiral is tightening. Disordered sleep drains the energy to connect, while loneliness fuels stress, making sleep even harder. Day after day, quality of life is quietly worn away without a name. Older adults are especially vulnerable to this spiral, because so many layers stack together. Aging naturally shifts the body's clock earlier, lowers melatonin, and daylight no longer resets the rhythm as strongly as before. But persistent insomnia rarely stems from that alone. Chronic pain, especially from arthritis, scratches like a thorn, preventing relaxation, breaking the night into fragments. Sleep apnea cuts breathing into stutters, leaving sleep in shards and days in exhaustion. Only with continuous positive airway pressure does the body truly recover. Restless legs grow worse at night, forcing you to get up and walk, sometimes linked to iron deficiency or kidney disease that requires treatment. Repeated nighttime urination comes from the bladder, the prostate, diuretics, or heart disease, turning nights into shifts on duty. Anxiety and depression keep the brain on guard, unable to close the day, then opening too early, as if the inner clock has been wound wrong. Add in overlapping prescriptions, irregular sleep habits, or late-day coffee, small details that are enough to push a peaceful night out of reach. Withdrawal from social life is often mistaken as liking quiet, but in later years, it is a warning sign. When gatherings or hobbies that once lit you up become burdens, when family meals bring confusion because hearing is hard, the foundation may be depression, dementia, or hearing loss. The effort to follow every conversation consumes enormous energy. Without support, people choose silence just to avoid the strain. But silence, kept too long, erodes memory, emotion, even the will to step outside the door. The consequences of poor sleep and loneliness are not just weary days. They keep the nervous system pressing the gas pedal, raising blood pressure, weakening immunity, feeding a steady stream of inflammation. New memories fail to stick, cognitive reserves shrink, the risks of dementia and frailty rise. Mood slides downward, which in turn makes nights even worse. A cycle both steady and silent, but not unbreakable. The door opens with a comprehensive evaluation. It begins by telling your doctor about broken nights and days when you do not want to see anyone. That is not complaining, it is giving your body the right to be taken seriously. When pain is eased through therapy or proper medication, sleep has fewer intruders. When sleep apnea is diagnosed and treated, daylight suddenly brightens again. When iron deficiency or electrolyte imbalance is corrected, restless legs no longer drive you up at midnight. When nighttime urination is managed through adjusting conditions and medication timing, sleep flows unbroken. When prescriptions are reviewed and culprits removed, the body sighs in relief. Foundational habits, regular bedtimes, no late caffeine, a dark and quiet bedroom become a base to rest on. Cognitive behavioral therapy for insomnia restores a steady rhythm. Mental health support lifts you from the shell of silence. Putting on a hearing aid again, rejoining a club, attending a walking group or group therapy, each strand of connection becomes an anchor for sleep and for health. If you find yourself in this story, take it as a gentle yet urgent invitation. Do not remain alone with fragmented nights. Schedule an appointment, review your medications, reset your daily rhythm, and step outside to meet someone even once to begin. Small, steady changes can unravel an entire spiral, helping you reclaim energy, connection, and the kind of sleep that makes days worth living. 6. Breathing difficulties and chest pressure. There are moments when climbing only a few steps makes your chest tighten, as if an invisible belt had been pulled around it. Your breath shortens, and you need to stop and grip the railing. You tell yourself it must be from eating too much, from a pulled muscle, from age. But shortness of breath and chest heaviness, especially when they appear for the first time in midlife or older age, are not just normal. In the United States, breathing difficulties bring more than 3 million people to the emergency room each year, many tied to acute events like heart attack or pulmonary embolism. They are signals that the body is struggling with oxygen exchange, fluid in the lungs, or the heart under strain. When the heart cannot pump efficiently, fluid may back up into the lungs, making it harder to breathe when lying down, sometimes forcing you to sit up in the night gasping for air. Swollen legs, fatigue, a dry, persistent cough, with frothy sputum, rapid weight gain, from fluid together. These form the picture of heart failure, a condition affecting more than 6 million Americans. Early treatment with diuretics, ACE inhibitors, and lifestyle changes can slow its course and give the lungs relief. Sometimes, however, the airways themselves have been worn down over years of chronic inflammation, mucus, and tissue damage, as in COPD. Wheezing, a long cough, and breathlessness on hills are the hallmarks. Quitting smoking, using bronchodilators and corticosteroids, and pulmonary rehabilitation can restore deeper breaths. More dangerous still is pulmonary embolism, when a blood clot lodges in the pulmonary artery. Sudden shortness of breath, stabbing pain worse on deep inhalation, a racing heart, sometimes coughing up blood, This requires anticoagulation, and in severe cases, clot-busting drugs to restore flow. And then there is the heart attack, the crushing, squeezing weight behind the breastbone that may radiate to the jaw, the neck, the back, or the arm, with breathlessness, nausea, cold sweats, exhaustion. In older adults and women, it may disguise itself as indigestion or back pain. Timely reperfusion through medications or procedures marks the line between minimal damage and irreversible loss. Of course, there are other causes: pneumonia inflaming and burning the air sacs, asthma tightening the bronchial tubes, anemia leaving the blood starved of oxygen, even panic attacks making you breathless and dizzy. Whatever the cause, when shortness of breath is new, worsening, or paired with chest pain, dizziness, a racing heart, or swelling, it is reason enough to seek emergency care right away. Oxygen shortage does not wait. Delay risks lasting organ damage and can cost a life. Yet too often people postpone. Denial wraps it in labels like gas, a cramp, just getting old, while still getting behind the wheel while lightheaded. Fear of hospitals, cost, or losing independence holds people at home. Symptoms that appear differently, especially in women and minority communities, lead to late diagnoses. And because of reluctance to burden children, silence stretches another day. With each passing hour, the risk to the heart and lungs rises. The safe path begins with timely diagnosis. An electrocardiogram shows rhythm and heart strain. A chest X-ray or CT scan uncovers fluid, infection, or clots. Blood tests like troponin and dimer point to the next steps. Echocardiography evaluates the pump's strength, while lung function tests measure capacity. Treatment then follows the cause: diuretics for heart failure, bronchodilators for COPD, anticoagulants for embolism, reperfusion for heart attack. At the same time, quitting smoking, managing weight, tailored exercise, and pulmonary rehabilitation programs can lengthen your breaths. When anxiety or denial are barriers, counseling and support groups can help you step forward sooner. If your breathing feels different today, shorter, heavier, more painful, take it as a serious message. Call for help. Go where urgent evaluation can be made. Full, steady breath is the foundation of everything you love in life. Do not let it slip away for the sake of waiting one decision too long. 7. Changes in bowel or bladder habits. At first, it is only the smallest details in the bathroom. A bowel routine once steady begins to shift. Days of constipation, followed by loose stools, fragments that are thin like pencils, the uneasy sense of not being finished even after standing up. Sometimes you notice a streak of bright red on the tissue, or a tar-like darkness in the bowl. At night, the bladder wakes you again and again. By day, you stand at the toilet with a weak, interrupted stream, as if something is blocking the flow. You blame it on last night's meal, on age, on too much coffee. But in midlife and later years, these quiet changes can be the knock of something serious: colon, prostate, or bladder, and the most important step is not to ignore them. When a tumor in the colon narrows its passage, the body sends messages through changes in stool. Persistent shifts, pencil-thin shapes, from the tightening inside, the straining without relief, vague abdominal pain, sometimes mixed with mucus and blood. This is the colon speaking. Many also lose weight, develop anemia, or feel drained. The hopeful truth is that timely screening, with colonoscopy or hidden blood testing, can reveal the problem early, and when found early, survival rates can reach 90%. The question is not, is this worrisome, but is it time to check? In men, the prostate, whether enlarged or malignant, can press on the urethra, turning urination into a challenge, difficulty starting, weak stream, stops and starts, repeated trips at night, the bladder never fully empty. Sometimes there is blood in the urine or semen, or a heavy feeling in the pelvis. These signs are often mistaken for benign enlargement, which is why a PSA test and rectal exam are doors that need opening when they persist, especially with bleeding. With the bladder, the danger is how easily symptoms are brushed off as infection. Burning and urgency may feel like simple cystitis. But when urine is tinged pink, red, or cola dark, even if invisible to the eye, and when symptoms return after antibiotics, cystoscopy is the necessary step. the risk is higher after years of smoking. So, when is it serious? Any change lasting more than a few days, especially with abdominal pain, bleeding, weight loss, or unusual fatigue, deserves immediate evaluation. Guidelines remind us, after age 50, if symptoms last more than 2 weeks, screening is advised: colonoscopy, PSA testing, or bladder scope depending on the case. Timely diagnosis not only names the problem but opens paths of effective treatment, from surgery, chemotherapy, and radiation for cancer, to alpha blockers or 5-alpha reductase inhibitors for prostate disease, to antibiotics for infection. The hardest part is not always medical, but silence. These very private matters are difficult to speak of. Fear of losing dignity or independence holds people back. Habitual excuses of just old age delay appointments. In truth, up to half of older adults with urinary symptoms remain silent out of embarrassment. But silence does not heal. A straightforward conversation with your doctor can turn vague signs into a clear plan. Simple lab work, imaging when needed, and even support to ease the weight of shame. The door that protects you is not only medicine or procedure. It is also meals rich in fiber and water to keep the colon moving smoothly, the firm choice to quit smoking to ease the bladder's burden, pelvic floor exercises to regain control, and support groups to give voice to what is hard to say. If you see yourself in these words, this is not judgment. This is a gentle but firm invitation. Write down the changes in your body, schedule an appointment, open the door to screening. Early detection does not just improve outcomes, it preserves the independence, the peace of mind, and the dignity you deserve. If the beginning of this video was a door left slightly open where the body's quiet signals waited, then now, as we close, I hope you have stepped close enough to hear them more clearly. There are no sirens. Only a breath shorter than usual, a night broken into fragments, a fatigue that refuses to leave, a belt that fastens one notch looser. Small things. Yet these small things, repeated, can tell a very large story. The simple message to carry is this: listen to your body while it is still whispering. Do not wait until it has to shout. You do not need to change your entire life after one video. You only need to choose one action to begin today. Write a single page of a signal journal before bed and after waking. Schedule that long postponed checkup, or have an honest conversation with a loved one about what you have noticed. One page, one appointment, one conversation. Small steps, yet powerful enough to change direction. Because health, at its heart, is the chain of quiet decisions we repeat each day, decisions that protect our independence, our dignity, and our joy in living. If you recognize yourself in this story, remember this: you are not alone. Many people your age are also learning to read the handwriting of their bodies again, more slowly, but more deeply, carefully, but without fear. Let fear become your motivation, not your barrier. Do not blame yourself, choose to act. And if this video has been helpful, leave a thought in the comments. From today, what will you pay closer attention to in your body? Press like so that the algorithm carries this message to others. Subscribe to the channel so you will not miss the next videos on health and independence after midlife. Perhaps your single click tonight will be a quiet but precious gift for someone who needs to hear this.